So we'll be talking about vital signs. What is vital signs? Vital signs is the measurement of the body's most basic functions. Those basic functions of the body, the measurement of them, that is what we call vital sign. So this vital sign is actually the first thing that will be carried out on a patient that come to the hospital or rush to the hospital, whatever be the case. The very first thing that will be done on that patient is to carry out and check the vital signs of that patient, because this vital sign actually used to give idea or give guideline about the patient's health, or idea about the patient's health, what actually, like, it gives hints on what is actually wrong with the patient. It can also give an idea on how to treat that patient. For example, now somebody that is hypertensive, if you find out while checking the person's vital sign, you find out that this patient is actually hypertensive, and maybe you are supposed to give the person a therapeutic exercise or something of that kind. In that situation, you can't actually give that person that therapeutic exercise. You have to first of all look for a way to calm down the BP of that person first, bring it down to normal before you can now carry out any therapeutic exercise that you want to give to that patient. So that is that for that one. So we'll be talking about number one of the vital signs, which is temperature, body temperature. Body temperature actually have an average of it. The average of body temperature when you're measuring in Celsius is 37 degrees Celsius. And then when you're measuring in Fahrenheit, the normal average is 98.6. That is the average. But it also have a range, a normal range. When you're measuring in Celsius, the normal range ranges from 36.1 degrees Celsius to 37.2 degrees Celsius. And when you're measuring in Fahrenheit, it have a normal range of 97 Fahrenheit to 99 Fahrenheit. Any temperature below and or above this range is not normal, and temperature is measured using thermometer. There are so many parts of the body that you can measure this temperature. You can measure it orally, you can measure it at the axilla, you can measure it at the ear, or rectally, that is at the anus. These are the parts of the body where you can measure the body temperature. Some condition actually are the causes of this rise in body temperature. So the next one we'll be talking about is pulse rate. What is pulse rate? You can call it pulse rate or you call it heart rate. Pulse rate is actually the number of times the heart beats per 1 minute. Yeah, you get that? The number of times the heart beats per minute. That is what is called the pulse rate. And this pulse rate have a normal range from, for an adult at rest, not an adult that is stressed up or something like that. An adult at rest, the normal range of pulse rate is from 60 60 minutes 60 beats per minute to 100 beats per minute. That is the normal range. But anything that is below 60 beats per minute is not normal, or above 100 beats per minute is not normal. So take note of that. And also there are some things that can influence the change of this pulse rate, that can cause it to fluctuate, such as exercise. Somebody that just finish running now and just come back to sit down, if you check that person's pulse rate, you are definitely going to get a wrong result. Also, sicknesses, underlying illness can also cause a fluctuation in the pulse rate of an individual, of a patient. Another thing that can cause fluctuation is maybe emotions or injury. These are the things that can cause fluctuation on the pulse rate of an individual. So the next one we'll be talking about is respiratory rate. Respiratory rate is the number of beats, is number of breath per minute, not beat this time around. The number of breath per minute is what is called respiratory rate. You can call it breathing rate. So the normal range is from 12 12 breath per minute to 18 breaths per minute. That is the normal range. Anything below 12 or above 25 is not normal. So that is that for that. So the next one we'll be talking about is blood pressure. So blood pressure is the pressure exerted on the wall of the vessels, on the wall of the blood vessels by the blood. You get that? The pressure exerted on the wall of the blood vessels by the blood. That is blood pressure. So the normal blood pressure is 120 systolic over 70 diastolic millimeter mercury. So if you have something like 129 systolic over 80 diastolic millimeter mercury, that is to say you have an elevated blood pressure. And if you have anything above 130 systolic over 80 or 90 diastolic millimeter mercury, you are having a high blood pressure. So I advise that you always get yourself checked. Always check, especially your vital signs. Always check, especially your blood pressure. It can prevent so many things, so many unimaginable things that can happen to a person. When you check and you are okay, you notice that you are having high blood pressure, you get yourself treated and then avert all the unimaginable things that can come along with that. So that is that for today's video. Thank you for staying tuned. Thank you for watching my videos. Please, if you have not subscribed, please subscribe, like, give it a thumbs up, encourage me. Give it a thumbs up, share so that others get to know about this channel. Thank you. Bye bye. See you next time.